So in brief, a lameness workup is, first of all, history taking, then we go on to static examination, we then progress to dynamic examination, and then ordinarily we would progress to nerve blocking, regionally blocking out where we believe the source of the pain may be. Once we've numbed that area, the trot up, the lunge, and particularly the ridden exercise will be transformed and normalized. That then enables us to focus our imaging on the correct area. That helps us identify the cause of the lameness, and finally, the most appropriate and effective treatment can be instigated. So the first block we perform is the palmar digital block either side of the pastern in this area, and that blocks out the heel area. In truth, we often find it can block out the entire foot, but certainly the heel area. The next block is the abaxial sesamoid nerve block, which is either side of the fetlock here, and that blocks out generally everything below foot and pastern. The next block is the 4-point block. 1, 2, 3, and 4. 4 nerves, and that takes out fetlock, pastern, and everything beneath. And then my next block, just behind the knee on either side, and that blocks out the suspensory ligament. It's called the subcarpal block because this is the carpus, and it's underneath subcarpal, just there. If that hasn't worked for us, we'll then probably progress to blocking out the knee itself. That's within the joints. And then we can block out above the knee with the ulnar block here at the back of the leg, allied or paired with the median block, which is on the inside of the radius here. So these two together take out this area. And we then block the elbow here and the shoulder up here. So that's how we block the entire forelimb. Then the hind limb, we tend to start with foot block either side of the fetlock. In other words, the abaxial sesamoid nerve block here and here. We then move to a low 6-point block because there are additional 2 nerves around the front in the horse's hind limb. So here, here, and here, and the same on the inside, and that takes everything out there. Generally, after that, we tend to go for the suspensory ligament block, and then we block out the hock next. These are the lower hock joints, just here. Hock joints are very close to the origin of the suspensory ligament. Then we look to the main joint in the hock, which is the higher joint, because there are 4 joints in the hock. We've got the 3 lower flat joints, and then we've got the joint which does the majority of movement, and we can block this out. This is the tarsocrural joint or the tibiotarsal joint, and then we move up to the stifle. The stifle joint has 3 compartments, and we have the central femoropatellar joint, and then we have the lateral femorotibial joint here, and the mediofemorotibial, so femur to tibia joint and inside. So we want to block all 3 of those when we're blocking the stifle.